Hey everyone, it's Michelle. Welcome back to another video. So in this video, I want to share with you 20 commonly used vocab in the hospital setting, and I've grouped them into 4 categories. So the first one we're going to start off with are the names of the healthcare professionals that you would commonly see in the hospital setting. So the first one is physicians or doctors. Physicians or doctors. So these two words mean the exact same thing. They're completely interchangeable. And an example of how you might use these words is Dr. Lee is an internal medicine physician on Unit 34. Next is surgeon. Surgeon. So an example of how you might use this is Dr. Zhang is a general surgeon who is currently in the OR. And OR just stands for operating room. Nurse. Nurse. So example is Alex is a veteran nurse. He has over 24 years of experience working in the ER, and ER stands for emergency room. Pharmacist. Pharmacist. Liu Ke is a pharmacist on Unit 56. He knows all about urology medications. Physical therapist. Physical therapist. Stephen is a physical therapist, and he has just designed the most magnificent rehabilitation plan for patients recovering from femoral fractures. Specialist. Specialist. So Dr. Williams is a specialist of cancers, of blood cancers. He is a hematologist oncologist. The second category I want to talk about is appointments. So an example of how that can be used is, for instance, the patient books an appointment with Dr. Jones in order to take out his stitches. So vocabulary associated with the word appointments include clinic visit, and also virtual appointment, and lastly, follow-up. So these all indicate a need to go and see the healthcare professional. Whether that is in person or virtually. The third category is blood draws. So for instance, a nurse might say to her patient, I'm here to do a blood draw, or the nurse can also say, I'm here to take a blood sample so that we can use that blood sample to do a blood culture and see what's causing this infection. So associated vocabulary to the word blood draw include blood sample and blood test. So blood sample, blood test. And these all indicate a need to draw blood. The last category is vital signs. Vital signs. So how you might hear that used in a clinical setting is the nurse says to her colleagues, I'm going to go in and do another set of vital signs or vitals once the patient in 3-bed 1 is done with the blood transfusion. So vocabulary that are associated with the word vital signs include blood pressure, heart rate or pulse, respiratory rate, or you can say rate of breathing, temperature. And then the last two, it depends on the source, but many also consider pain, and oxygen saturation to be the 2 other vital signs. But the thing with oxygen saturation is that healthcare professionals are usually pretty lazy with that, and instead of saying oxygen saturation, they'll usually just shorten it to say O2 sat. So they might say, hey, what's patient 3-bed 1's O2 sat? All right, and that's it for today. So hopefully you found this video helpful. Please give it a thumbs up if you did. Also, let me know if I made any mistakes with the Mandarin translations. I'll make sure to correct those in the future, and it will also help me learn something new as well. Thank you so much for watching this video, and I'll see you guys in the next one. Bye.